This class is brought to you by the LA Care and Blue Shield Promise Community Resource Centers. The centers are a place to help you be active, healthy, and informed. We hope you enjoy this virtual class.
Today's class will be going over the basics of oral health and practicing good oral hygiene for both adults and for children. I hope you enjoy. For most of us, our living situations have been modified. Now is a great time to talk, teach, and assist your children on how to brush their teeth. But first, it is very important that we take care of our own oral hygiene so that we can model positive behavior and positive oral hygiene to our little ones. So what exactly can we do to model good oral hygiene for ourselves and for our little ones? Simply brushing our teeth twice a day for 2 minutes and making sure that we do share these experiences with our children. For example, bringing your little one with you so that you can brush your teeth together, and always assist your children until they are old enough and capable enough and developmentally ready. If you have a baby at home, we recommend to rub the gums gently with a warm washcloth, something like this, and then just gently rub around the gum line to make sure that we get rid of any milk residue that might be on the baby's gum lines. This can also bring your baby some comfort. Something else that we can do for baby's comfort when they are teething is we can place a wet washcloth in the freezer and then simply give it to the babies after to nibble on. This will bring great comfort to their gums. But in the meantime, just make sure that we are cleaning their gum lines just as we would brush our own teeth. So how should we brush our teeth? Well, we want to make sure that we're brushing for 2 minutes every single day, twice a day. We grab our toothbrush and we're gonna grab just the size of a pea of toothpaste. We're going to pretend that this is the amount of toothpaste that we have on our toothbrush. That is all you need, a very, very small amount. That goes for anybody who's 12 years or older. If you have little ones under 12, you're going to put the size of a rice. Now you're gonna start brushing in circles. We want to have the motion so that we can brush our teeth, and we're also brushing our gum lines very gently. We want to think of a massage for our gum lines. We want to make sure that we're brushing all of our teeth all around in circles. When we get to our molars, that's when we can start brushing side to side. Making sure that we're getting every single molar. Once you get into these teeth right here at the bottom and at the top, we want to make sure that we're brushing out. After you have brushed for 2 minutes, we're going to spit out any residue that's in our mouth, and we're not going to rinse. We want to make sure that the toothpaste stays on our teeth so that it does its job for protecting our teeth from any caries, from any bacteria, from any sugar bugs that might be sitting in our teeth. Now that we know exactly how we should be brushing our teeth for ourselves and for our little ones, right now is a great time to spend time, special time with our children and with our families, to tie and to introduce children to some healthier practices that will help their teeth and their overall health. We know that in California, children by the time they hit 3rd grade are already showing multiple cavities and or tooth decay. Now, tooth decay is very painful. It can prevent children from eating, from speaking, and it can hold them back from learning. Why? Because it's very painful. All we need to do is encourage children to drink more water by providing them with their own water bottle, for example, or giving them their own special cup, encouraging them that water is good for them and that water can be fun. For example, creating a chart for them. They can cross off how many water bottles they drank a day or how many ounces they drank a day. This will make it exciting for them, and it will give them a great sense of responsibility to know that they're taking really good care of themselves and they're taking special care of their teeth. Also, what we can do is have them set a chart of brushing their teeth. Have I brushed my teeth today? How many times did I brush my teeth this week? So that they can have something to look forward to when they go to the dental office and they can present this to their dentist. This will give them a sense of encouragement to want to do better for themselves. At least remember to visit your dentist every 6 months. Unless your dentist wants you to come in a little more often, that's okay. And make sure that you brush your teeth twice a day for 2 minutes and use just the exact amount of toothpaste that your teeth need. If you are over 12 years old, just use the size of a pea, and if you're under 12, the size of a rice. And also make sure that you're drinking enough water to protect your teeth and wash off any food that may be sitting in your teeth and hiding in there. We don't want any sugar bugs. And water is also really good for our metabolism and our skin and our overall health. Make sure that you're eating fruits and vegetables. Let's make it fun for ourselves and for our little ones. I'm sure you guys are all doing an amazing job. Let's keep this going and make oral hygiene as fun as we possibly can. Let's take care of each other. Thank you so much for joining me. We look forward to seeing you again next week virtually, and hopefully in one of our research centers as soon as we can open. Until then, stay active, healthy, and informed. Take care.